There was a staffing shortage due to COVID. And my husband and I, we were not surprised by that in the least bit.
From masks to tight spaces and postpartum rooms, giving birth during the fifth wave of COVID-19 in Alberta comes with a lot of challenges families wouldn't normally need to consider. But it's a first-hand experience Brenna Sierek shares with us after giving birth here at Calgary's Foothills Hospital.
We were getting ready to check out. There was a delay in our paperwork for a couple of hours. And some of the nurses came in and told us that the reason there was a holdup was because some of the staff was out with COVID. And we were not entirely surprised to hear that, because through the course of us being there, we noticed that a lot of the staff were coming in wearing just surgical masks.
Sierek says she doesn't know why they weren't wearing N95 masks or eye protection, but she was happy she was able to keep hers on the entire time.
Obviously, it went fantastic because we all made it home COVID-free.
City News spoke to Sierek just before Christmas when she was 9 months pregnant. Back then, she shared concerns about being in a postpartum room, and after this experience, feels those concerns were at least somewhat justified.
If anyone has ever been to university, they know what the dorm rooms are like. And they're very, very small, especially if you're sharing with another person. So essentially, think about a dorm room and just having a curtain down the middle of a dorm room. And that is the Foothills Hospital labor and delivery ward.
She doesn't believe there was 6 feet between her and the other mom and newborn, but despite the tight space, she says she did feel safe, as she was paired with another couple that were just as cautious as them. Sierek feels lucky to have had a great experience bringing her baby girl, Coraline Magnolia, into the world, despite being in a global pandemic.
We're looking forward to going back there in the future with maybe baby number 3.
In Calgary, Kristy Kilburn, City News.